Sonoma Developmental Center was founded in 1891 by Julia Judah and Frances Bentley, who were two mothers who were looking for services west of the Mississippi, of which there was really none for people with disabilities in that time period. As time went on, though, the need for services for people with a variety of disabilities and social issues became bigger and bigger.
Care centers for disabled individuals started to open in America in the 1770s. At that time, many families were either unable to, did not want to, or did not know how to take care of those who were dependent on others due to their physical or mental disabilities. The Sonoma Developmental Center opened in California in 1891. By the year 1900, they had over 450 residents and hundreds more on the waiting list. The center, originally called the California Home for the Care and Training of the Feeble-Minded Children, aimed to care for disabled children. Over time, they opened it up to disabled adults. The Sonoma Developmental Center was known to perform experiments on patients before the 1970s. The Developmental Center performed the most forced sterilizations on patients of any institution in the country. Patients often unknowingly were used as guinea pigs in vaccine experiments, even going as far as putting live polio viruses in milk and having children drink it. This human experimentation on people with disabilities, although horrific and dehumanizing, was normalized at the time. Along with experiments on patients, abuse and neglect were so common that they were considered normal. Many of these abuse cases went unreported due to the poor communication skills of the patients. Teresa Murphy, a resident of Glen Ellen who worked at the Sonoma Developmental Center for more than 30 years, is knowledgeable about the center.
There were dark times here. It's an institution, it was overcrowded. There were people here who were misplaced and, probably not the best of medical practices. However, that was the thinking of the day. There was many people that did have sterilization process operations here.
The harsh living conditions and the abuse of power that many people in these centers faced would change as time went on. Such things as human testing became less accepted. In the 1970s, Sonoma Developmental Center started to make changes to improve the living conditions for the patients there.
The legislature granted millions of dollars to have each building retrofitted so that there was private to semi-private rooms, one person to four persons in a room, and the big congregate bedrooms were gone. Across the world, there was a shift in opinion about congregate living, and institutional living was not favored anymore. Yes, it was taken seriously, and yes, it happened, and it's unfortunate, but it's true. We had a human rights committee here at the Developmental Center, and anytime anybody had any kind of medical intervention, it was decided by the ID team, the interdisciplinary team. We had a client's rights advocate that was instituted. We had a human rights committee. We had a bioethics committee. There was many different processes that were instituted to help protect the individual and their human rights of those folks.
Centers like Sonoma Developmental Center got better, and they stopped testing patients with radiation poisoning and other human testing that was being performed there. Although there are few medical records of testing on patients at the Sonoma Developmental Center, there were many cases of death due to the testing that occurred at the center. A local paper stated that radiation testing was done on 16,000 people, some of whom were from the Sonoma Developmental Center. When cases of abuse arose, they were able to take correct measures to ensure it wouldn't happen again. Though there are centers like Sonoma Developmental Center that are able to take steps to improve their care, there are still care facilities that continue to neglect and mistreat their patients. The problem of abuse and neglect in these care facilities would decrease, if not completely disappear, if centers put effort into communicating the specific needs of the patient. Fox KTVU reports on a story from just across the bay in Oakland. Mitch Freeze, a father of a developmentally disabled son, talks to a group of parents whose developmentally disabled kids have been mistreated by care facilities in 2019. Freeze speaks of the disturbing levels of neglect that his son faced. The mattress was so urine-soaked that it went through and rotted the box springs. The bed was on the floor with no sheets. He described how his son's living conditions didn't get better and care staff did not care. You watch your child suffer broken bones, Bones on both eye sockets were broken by staff. The North Bay Regional Center, which is located in Napa, is responsible for finding care for these disabled individuals and monitoring if their care is up to standard, but is failing these patients. This lack of inspections isn't an uncommon occurrence for these regional centers. We can improve care centers by helping at local centers, making sure centers communicate with their patients and helping to understand what is best for them. Then, if those centers fail, people should go to DDS and hold them accountable for their unjust treatment of the patients under their care. There are different levels of care designed to help people who are dependent on others due to their disabilities, ranging from small local centers to state and federal organizations. Starting on a smaller level, you can draw attention to abuse in your local centers, in doing so, helping to hold these institutions accountable. In addition, the overarching government-run agency for the local care centers, DDS, should be held more accountable for the mistakes and instances of abuse within these facilities. When local centers have cases of abuse that are not dealt with, DDS should keep them in check. We must raise more awareness as a collective that these government agencies are not being held to the care standards that are needed to support these patients. We can learn from some facilities like Sonoma Developmental Center. In order to improve care, centers must make more of an effort to connect with their patients through communication and making them feel more comfortable. Along with holding care centers accountable who are not up to standard, we as a community can help one of the most vulnerable groups of citizens in California.